Welcome to the theobspod. I'm an NHS obstetrician, hoping to share some thoughts and experiences about my working life. Perhaps you enjoy Call the Midwife, maybe birth fascinates you, or you're simply curious about what exactly an obstetrician is. You might be pregnant and preparing for birth. Perhaps you work in maternity and want to know what makes your obstetric colleagues tick, or you want some fresh ideas and inspiration. Whichever of these is the case, and for that matter, anyone else that's interested, the theobspod is for you. Episode 46. Doulas. I had a lovely comment and a question from a listener, Rebecca. She's enjoying my podcast and said that much of what I said about the ethos of caring for women aligns with the role of a doula, supporting women. She wrote this from the perspective of being a doula and asked whether I'd consider doing an episode on doulas. So, Rebecca, here it is. What is a doula? It comes from Greek. The definition is a woman servant. It was coined in the 1970s to mean a woman who provides physical and emotional support to a woman in labour, without handling the more technical aspects. This support might include massage, it might include reassurance, something to eat or drink, and simply staying by a mother's side. Many studies have shown that this reduces the intervention rates, so a reduction in caesarean section rates. And therefore it's not surprising, given the focus on this and the need to reduce unnecessary intervention, that we are sometimes turning to doulas more. Some NHS organisations have piloted the employment of doulas, and this is potentially an excellent plan. But we need to be careful. Will we lose some of the benefit if a couple have not chosen the doula themselves and established an existing relationship with them prior to the labour and birth? There's an interesting article about this, which I've enclosed in the programme notes. When we think about the idea of a woman providing physical and emotional support to a woman in labour, many of us may start to question, what is the difference between a doula and a midwife? Or between a doula and a midwifery support worker? Where are the boundaries? What's the difference in roles? And indeed, some people I know have progressed between careers. They may have started as a support worker or a doula and gone on to do midwifery training and become a midwife. One of the key roles of a midwife is to support a woman. And this question about what is the role of the doula versus what is the role of a midwife can lead to conflict. When we have doulas involved in the care of women we're looking after, this can sometimes generate mixed feelings. Midwives can feel that the support of the woman is their role. After all, the standard that we work towards of one-to-one care in labour, so one midwife caring for one woman, is built on this assumption. A woman in labour needs the focused attention of a midwife, solely on her need, her care. But has midwifery become more task-orientated? I know that there are many things a midwife needs to technically do. She will need to monitor the baby's heartbeat, whether that is intermittently listening in or with a continuous tracing. She will need to check the woman's pulse, blood pressure, temperature. She will need to do endless reams of paperwork, recording what's going on. She will need to discuss pain relief options and provide them. If an epidural is in place, she will need to regularly perform observations to make sure it is being managed safely. She will need to record when the woman passes urine and consider whether the woman needs a catheter to empty her bladder. She will also need to document and observe the progress of the labour. Then she will need to enter all this into an IT system. She will need to follow many guidelines to ensure the safety of the woman and the baby. And she will need to go and check these with other members of the team to ensure that she's not being blinded by the fact she's in the room constantly. She will need to seek a fresh view. Whilst all these tasks are beneficial and are set on the basis of good evidence and guidance, can this disrupt the relationship between midwife and woman? And is that where a doula fits in? Thinking a bit about the boundary between doulas and midwives, I thought I would talk to Kate. Kate was originally a doula and chair of our Maternity Voice partnership. Kate has now taken the step from doula to midwife, undertaking her midwifery training, and is now a newly qualified midwife at the unit I work at. So I thought I would get her thoughts on my episode recorded so far and what she feels the role of a doula is. Her perspective is doulas are for the whole family, not just the woman, but including the partner. She felt that doulas have something to contribute in improving the involvement of the partner and reducing trauma for that partner by clear, reassuring communication if things are not going straightforwardly. Another thought was about time and space. I've talked before in episodes about giving women time to think about the decisions they're making, rather than us pressing them into immediate decisions. She felt that doulas have a lot to contribute here, making sure families feel they can ask anything and have time to reflect and decide. I love the way she described this as a pause in a fast-moving system where parents can feel out of control. That's such a good way of thinking about it. There are two sides to everything. Some midwives are really happy to have a doula, an extra pair of hands and someone who knows the woman in and out, knows what's important to her, knows what her concerns are and what her vulnerabilities are. So it can be a positive relationship between midwife and doula. Historically, there can be sometimes a negative attitude when a doula is mentioned at handover. It might be said slightly disparagingly, "There's a doula in that room." We can be sceptical and worry that there'll be interference in the relationship between the healthcare professionals, ourselves, the midwives and obstetricians, and the woman. We fear that the doula may seem to speak for the woman, perhaps encouraging unrealistic expectations or causing a woman to decline to accept the treatment we are recommending and we think is essential. Can the woman end up caught in the middle between the doula and the healthcare professionals? Maybe we're distrustful about their training, their lack of medical or midwifery qualification. They're coming into our space, on our territory. What do they know? After all, we're the experts, aren't we? And can we see doulas as a posh thing? Something financially well-off people can afford and others not. A bit of a luxury item to have someone come and soothe you and look after you in labour. And does this mean that the woman doesn't trust us to care for her in labour? We can feel, have we done something wrong that she feels she needs this additional support? As usual, it's often a case of blaming the others, those other people, without understanding and seeing their perspective and that of the woman. One of the action pledges from the first ever maternity experience workshop held at Kingston in 2014 was to have regular meetings with our local doulas. If you only see a doula once in a blue moon on your labour ward, then how can you get to know what their perspective is? And if you only encounter them when they're in the midst of caring for a woman. These meetings were excellent. Doulas would bring cake, we would supply tea and coffee, and we would get together, midwives and doulas, and discuss how we might work better together and understand each other's aims. We had a number of regular meetings between our supervisors of midwives, labour ward team, and doulas. I was the only obstetrician, it's true. But those meetings were so beneficial. A relaxed environment in which to chat, discuss things, and as Rebecca said, discover that we have much in common. Our aims are very much aligned, and that doulas could help us support women when we're feeling a bit stretched, a bit thin on the ground. The doulas also provided massages. It was wonderful to see stressed, tired staff sit down and be transformed, relaxed by the care and attention of a doula. And for me, my understanding of doulas definitely had a significant gear change when I undertook my lithotomy challenge that I discussed in episode 21. Kate, who was the chair of our Maternity Voice partnership and at that time a doula, walked into the room, came straight to me, offered me a foot massage and started gently to massage my feet, talk to me in a low voice, see me as a person, reassure me, relax me. It made a massive difference. It made me feel human rather than an object. And suddenly I could see what she provided for women in her care. That intimate support and reassurance by my side. Not doing anything medical, not performing any tasks, just being there for me and somehow instinctively knowing what I might need before I knew it myself. I was very grateful to her, not so much for the massage, which was lovely, but for opening my eyes and making me think differently about the role of a doula as a result. As I'm recording this during COVID, I'm thinking about what's happening with doulas now. I know many of our local doulas are doing more postnatal care, or perhaps being present at the increasing number of home births. But the restrictions on visiting during COVID has made it much more difficult for doulas to be present on our labour ward in the hospital. It's quite right that we should restrict visiting, restrict footfall in the hospital, and decrease the chance of infection. But we've gone from having 2 birth partners automatically, perhaps a woman's partner and her mother, or perhaps her partner and a doula, to having a single birth partner. How has this impacted on the women we're caring for? And how has this impacted on the support they might have got from a doula? Women are feeling more isolated and alone. Our Maternity Voice partnership is running some focus groups to look at the women giving birth during COVID in more depth. Some women are choosing home birth, partly so they can have control over who is present. Yes, for some women with a specific issue, we will apply for exemption from the maternity service management. But how many women will push that hard to get what they feel they need? How many, if they're told they're allowed one person, will not question it, will not see whether there is a way round it? Another time when having a doula can prove more challenging is if a woman needs to give birth in theatre. It can be a point when the woman is at her most vulnerable. Suddenly plans have changed. She's perhaps going to theatre for a caesarean birth or an assisted birth. And at that point, we tell her one person in the operating theatre. And again, that's because the operating theatre gets quite busy, and it's very important that we have a very sterile, safe space, and that we're able to focus on caring for the woman. But this moment that the woman was not expecting, perhaps that's when her doula could be most valuable to her and could be supportive to her and could make her feel more at ease and therefore make our staff job easier. She'll be less fearful. She may feel better supported. And why shouldn't a doula join us? Again, the doula can support the family. Partners are often at sea in theatre. It's not a familiar environment, and a doula can help gently guide and explain. The midwife can perhaps focus on the tasks that she needs to do to ensure that things are going ahead safely. The checklist that needs performing, making sure the resuscitator is ready for the baby. All these tasks take the midwife away from being at the woman's side. So we could be more inventive about how we use a doula and how we acknowledge her role in the care of women we're looking after. We have a number of local doulas involved in our Maternity Voice partnership. They bring us opportunity. They can be our fresh eyes and ears, observing what's happening on our wards or to women under our care that we can't see for ourselves. A woman might feel too intimidated to comment or give us direct feedback about her experiences or difficulties with her care. But she might trust and tell her doula, who can subsequently feed back to us. I wonder whether, as we improve continuity of care with midwives so that women know and trust their midwives and build relationships with their midwives and hopefully know the midwife caring for them during their labour, whether at that point, if we can meet that need, reach that aim, whether doulas would become a less important part of the equation. Would they become obsolete if we go back to that relationship-based care? Who knows? Coming to the zesty bit, I'd like to suggest that you meet up and get to know your local doulas. Even if this has to be done virtually because of lockdown, you will build relationships. Explore Doula UK, founded in 2001, which provides training but also tells you more about the role of a doula. And know that doulas are feasible for everyone. If there's a woman who you feel would especially benefit, you can refer a woman to the Doula Access Fund. There are also organisations such as Doulas Without Borders, which can support women who cannot pay. And I've put a link in the programme notes. When you encounter a doula on your birth centre, or on your labour ward. Be open-minded. Why is she there? What is it that that particular woman is needing, that she is providing? Respecting the doula is part of respecting that woman. That woman has chosen to have her there at her birth. As a pregnant woman, know your options. Understand what a doula might do for you or bring to your maternity experience. Would it be a useful thing for you to explore more? So I hope this episode has fulfilled Rebecca's question. If, like Rebecca, there's a particular topic you'd like me to tackle, don't hesitate to contact me via Twitter and let me know. I do hope you've enjoyed listening to this episode of theobspod. Feel free to contact me on Twitter at FWmaternity or at theobspod to ask me questions, give me topics for future episodes, or let me know what you think. It's absolutely fantastic when you get in touch. I really enjoy reading your comments. As usual, I've tried to include in the programme notes some extra reading about this particular topic, both for professionals working in maternity care and for pregnant women using services. I'd like to reassure you that although I'm talking about my experiences working in maternity care, I take confidentiality very seriously and do not give any personal information about any of my patients. If you've enjoyed listening, I'd love you to recommend the theobspod to friends or colleagues, and please do leave me a review on whichever podcast directory you find my episodes. Many thanks for listening.